I'm Dr. Robert Zann. I'm a board-certified orthopedic surgeon practicing in Florida for over 25 years. I specialize in hip and knee replacement surgery and have performed over 10,000 joint replacements. I take great pride in what I do. I care for my patients. I worry about them. I worry about their outcomes. I worry about how they do. As a result of this, our complication rate is extremely low. As you may be aware, because of the recent media coverage, the Stryker Rejuvenate Modular Hip System has been found to have problems associated with the femoral component. If you are a patient of mine who has received this system, or a family member of a patient, we ask you to please view this video from start to finish. This is a serious situation that I've been trying to address since we became aware of the fact that many of our patients have problems associated with this hip. I stopped using this hip system in March of 2012, 3 months before the device was recalled by Stryker. We did not realize that the problem was secondary to underlying metal sensitivity. This was not even known to exist until March of this year, when I went up to Stryker as a consultant to discuss the matter with them. We found at that time that the percent of patients experiencing metal sensitivity was estimated at 0.5%. When we returned to Florida and started looking at our patients more closely and started contacting our patients to see who actually were having problems, we thought that these were back problems, we thought that they were nerve problems, but we weren't convinced anymore that it wasn't related to the hip. So we began doing blood testing. We tested them for chrome and cobalt levels. And what we found is that while Stryker originally thought it was a 0.5% complication rate, 10 to 20% of our patients immediately were testing positive for elevated chrome and cobalt levels. After this, we began doing MRI scans. Again, there was no protocol established anywhere in the United States for how to detect metal sensitivity with this particular type of device. What we found was a large amount of fluid accumulating around the hip called a pseudotumor was found in not 0.5 and not 10% of our patients, but as high as 20% of our patients. Since April, when we first started taking these patients back to surgery for intractable pain or various other medical problems, we found that the percentage is no longer 10 to 20%. We've already revised, as of now, 10% of our patients, and the numbers are increasing. We're going to try to update you from month to month, telling you what the current knowledge is regarding metal sensitivity in the United States and the world. We will update you with a new website in November. My goal is to make sure that our patients all not only are taken care of the way they should be, but also they know what's going on in the world regarding this product and other products of similar companies that are in the market right now, and nobody yet is discussing them. We don't hide anything from our patients. We never will. We want our patients educated. We want them to trust us, and because they trust us, they're going to get treated correctly. I hope you all realize that my goal and my staff's goal is in your best interest. Stay healthy. As I tell patients all the time, once they have their hips done or their knees done, and they come back and they're happy, I say, you have your life back. I intend to make sure everyone going through this tragic situation gets their life back.